Riddle me this. There's a drug out there, a medication that one of the side effects of it is it causes the thing it's supposed to prevent.
Yeah, I know what you're talking about. You're talking about bisphosphonates.
Bisphosphonates. Fun to say.
Yeah.
Not always fun to take.
Right. So this is a medication designed to reduce your risk of osteoporosis and osteoporosis-related fractures. And one of the complications is that it causes a femur fracture.
That's it.
It's wild.
It's like robbing Peter to pay Paul, which
even say it.
Normally I'm okay with, but in this case, it's kind of tricky, isn't it?
So bisphosphonates, there's a lot of different names. Fosamax, alendronate, it's been genericized, so lots of people taking them. We're going to talk about what they are, how they work, whether or not you should keep taking them. Take-home messages, definitely talk to your doctor. Don't stop taking them because of this video. But what's the risk involved?
Well, the risk involved is something that we see as orthopedic surgeons.
Yes.
We see this, right? And I remember we used to call these years ago, call them Fosamax fractures.
Yep.
You'd see a certain type of fracture in the femur, and we knew that it was caused by, or very likely caused by, this medication.
Okay, before we get there though, let's first talk about the problem. What problem are we trying to treat?
We're talking about osteoporosis, which is a big problem. Osteoporosis is bone mineralization that's gone down as we age,
yes,
and puts you at risk for a fracture.
Right, and we actually have a great video about how to increase your bone density other ways other than drugs. You should consider watching it if you have osteoporosis or even osteopenia, which is the pre-osteoporosis.
Right, and now there have been a lot of medications that have come out to minimize the risk of osteoporosis and minimize the risk of fracture.
Right,
okay,
so
to treat it basically.
Right, so the way that someone gets put on this is if you have minus 2.5 standard deviations from what your bone density is supposed to be, or minus 1 standard deviation and have already had what's called a fragility fracture, a specific location.
That's typically a hip fracture, a lumbar spine fracture, or a wrist fracture.
Right.
Okay, and so these drugs have been amazing.
Yes.
You know what I mean? They've been very good at reducing the number of fractures and increasing bone mineral density.
Undoubtedly, they work for their primary goal.
Right.
Yes.
But like any treatment, there is always the risk of harm associated with any treatment. Even taking an aspirin, there's a good chance the benefit is it'll get rid of your headache or get rid of your muscle pain. The bad side is you can get an ulcer and you can die from it.
Right.
So every treatment has risks and benefits.
And the way that this class of medication works kind of explains why the complications happen.
Right.
So our bone is a very active living structure, so it's always being turned over. So our bodies are making bone, resorbing bone, making bone, resorbing bone. That's kind of how it works.
Right.
And if you can influence either of those processes, you're going to change whether you're making more bone or taking away more bone. So the way that bisphosphonate works is it attaches to the bone and inhibits something called an osteoclast, which is that cell that resorbs your bone. So we reduce bone resorption, which allows you to maintain more of your bone density and avoid osteoporosis.
Right, an osteoblast is the test cell type that increases bone mass.
Right. Okay, so like we said, these work very well. They unfortunately are expensive medications in Canada. Some of the name branded ones are in the $750 to $1,200 a year, and then the generic size kind of $150 to $300, and in the US it could be even more. Thankfully it's covered by our socialized healthcare system, but they do have some risks and some complications.
And you should know that. You should be aware of risks no matter what treatment you take. You should be aware of these risks to see if it's happening to you. You know what I mean? We're not saying don't take the medication, but be aware of these risks in case you can sense something like this happening to you. You can go see your doctor if it is.
Right. And when we were in residency, this is when it kind of started, about 20 years ago. They were starting to be used more regularly. And it's designed to prevent hip fractures that are higher up on the upper part of the femur. But we started seeing these very unique fractures that were typically uncommon. It was more of a horizontal fracture line. It was below something called your lesser trochanteric, so it's called a subtrochanteric femur fracture. And often it wasn't all the way through. It was just kind of cracked on the outside, looked almost like a stress fracture, right? Had that appearance. And the thought is that this happens because your body is trying to remodel that bone. And in our femur, it is a slightly less active because there's a lot of cortical bone, really hard cortical bone. So you're having these little micro fractures that your body normally repairs, but because we're inhibiting the osteoclast to remodel it, you were undergoing inadequate remodeling, and then this led to a complete fracture. So people were coming with thigh pain.
Right.
And then we do an x-ray and be like, look at that looks really weird.
That's right, and it looks like a stress fracture, which is like a fatigue type fracture because you have inhibited the bone's ability to heal itself from these minor little cracks that happen with just everyday life. The bones are usually just remodeling and fixing those little tiny micro damages.
Right.
However, by blocking that process,
Yep.
in addition to blocking loss of bone mineral density and helping osteoporosis, you've also blocked the bone's ability to heal itself in those microfracture settings. And so these fractures occur, and they're a little harder to treat.
Sure.
At the end of the day.
So sometimes people would show up with like a frankly displaced fracture, but other times it would be more vague and nuanced, like there'd be thigh pain and they'd have a little bit of a crack, and we weren't really sure what to do at first. So we would treat them like we treated all those types of fractures, but they didn't heal quite as readily. Often they took 6 or 12 months to heal, so it was a little trickier.
Yeah. And it did turn into sort of class action lawsuits occurred with these sort of, we call them Fosamax fractures or atypical femur fractures now, we call them.
AFFs.
Why do you think that was? Why do you think there was class action lawsuits, but these drugs are still available and there's no class action lawsuits now?
Well, I guess, I don't know the details, but my guess is that either they knew about it, this being a possibility before, or they had not mentioned that it was a possibility.
Yeah, that's it. They didn't mention it was a possibility. They may not have even known about it, but they were it was the first of its kind of drug that was out there.
Yeah.
It had a monopoly. Tons of people went on it.
And maybe not for a long time, too. That's the trouble with, that's why drugs have to have long follow-ups before we send them to market, or we have to be careful, because some of the problems show up later on.
That's right, and that's exactly what happened here. These problems showed up later on.
Yeah.
So patterns were detected. People saw that this was a complication of this medication. So that's when lawyers got involved, class action lawsuits occurred. But now, with more proper labeling and more proper education, the same drug class exists, but the big lawsuits don't happen because on the label of the medication says, hey, watch out, this could happen.
And because it is such a good medication and it's such a difficult problem to treat, the osteoporosis part, that it can be considered an acceptable risk. And that's a decision for you to make with your doctor, depending on your own specific situation. But like, how common is this? So this happens between 3.2 and 50 times per 100,000 years of drug treatment.
Right.
So it's a pretty small number, but it is a very real population. We see these people. Not a lot, like we don't see tons of them, but they exist for sure.
It's a small percentage, but a lot of people are on these medications. So the absolute number of these happening is not so tiny in our world, because that's what we see, that's what we treat. And so therefore, why is this useful information for you? If you're on this medication and you start to feel some thigh pain, don't ignore it. Go get it checked out and get it worked up. It'll be an X-ray to start, and then maybe even a CT or an MRI if it can't be seen on X-ray, because sometimes these cracks exist and you can't see them yet on X-ray. So be vigilant of that, because this is one of the side effects of this medication. We see this on a regular basis, so we just want you to be aware. So if this is happening to you, you can go see your doctor.
And so let's talk about treatment. So say you got the thigh pain, you go to your doctor, like, looks like you're brewing an atypical femur fracture. What is the treatment?
The treatment, well, first it's going to be in conjunction with your endocrinologist or whoever started you on this medication. You have to consider a drug holiday, we call it, where perhaps going off this medication for a while.
Like 1 to 3 years, I read.
Yes. And then typically to treat these fractures, if it's very early and very hard to see the thing, I have treated these sometimes non-operatively.
Protect the weight bearing.
Protect the weight bearing and see if, and follow it along every few weeks with an X-ray and see if it's healing. If it doesn't heal or it's getting worse, then it's surgical intervention with some kind of open reduction internal fixation.
Typically a metal rod that is, it's not a benign procedure, like it's a big deal to people.
It's surgery.
But it's successful.
And then it is usually successful in treating it. So there is treatment for this complication, but we just want everyone to be aware that this...
And I'd say that's number one that people worry about, like, I don't want to be taking any of your bisphosphonates, I don't want to get a femur fracture.
And that's the one that's most relevant for us. There are some other serious...
For me, I think number 2 is, almost because I'm an orthopedic surgeon, I'm more scared of number 2, I think, the osteonecrosis of the jaw. It just sounds bad.
I mean, some of the bone in your jaw can die in this medication.
And this is like the 1 in 1,000 to 1 in 10,000 kind of, again, pretty uncommon, but not insignificant. This is more patients rather than years. And often it will improve by stopping the medication, but sometimes you have to have a debridement, sometimes you have to have antibiotics because you get infected, sometimes you have to have reconstructive surgery, so it just depends.
Rare,
Thankfully, very rare.
But a big deal.
Gotta be aware. Be aware, even though it's rare.
Be aware of the rare.
Be aware of the rare.
Thank you for sharing. So the other things, there are other implications that maybe it can cause.
It's because you care.
That's okay.
Don't you dare.
We're getting nowhere here. Because of the, there could be esophageal cancer, I've heard. It's a possible thing.
So people that have trouble swallowing pills, that can be a real problem if they get stuck there.
Kidney issues.
Kidney issues, if you already have pre-existing kidney disease, can be a problem, as well as can alter your calcium balance.
Yes, hypocalcemia,
Hypocalcemia.
of course, because we're dealing with the bones, which is your body's storage for calcium.
And one of the best ways for our bodies to increase our calcium is actually to resorb bone and get it out of the bone and into the bloodstream, which a lot of us don't know. Like most of our calcium lives in our bones, not in our blood.
Yeah, the bones are little reactors, aren't they?
There you go.
Multi-purpose. And then, of course, there's some side effects that are typical of any kind of medication. GI problem. So, well, that's where the pill goes.
Yeah. So the take-home message is, listen, if you have osteoporosis, it's a serious problem, requires treatment. This is a long conversation with you and your family doctor or your endocrinologist, and listen to them and then make an educated decision. But beware of some of these symptoms and kind of pay attention to your body, listen to your body. And if you have concerns, talk to your doctor, get investigated. And if you have a comment or an experience of this, please share it with us, because this really helps our viewers know how to deal with their problems.
Yeah. Be aware and recognize that no matter what treatment you're being offered, there is always the risk of a complication with any treatment that you're offered by anyone, or any pill that you take always has a chance of a side effect or a complication, and you should know them so that you can know how to recognize it if it's happening to you.
Now you know.
There you go.
If you like this video, please like and subscribe to our channel.
And remember, you are in charge of your own health.
See you next time.